thank you everybody for being there. I'm really, really thrilled to spend this time together. We have an hour together to talk about women, trauma, mental health, and this wonderful conference that you've put together.
Yeah, excited to talk about it.
Yeah, so Tracy, you are a clinician specializing in trauma and including developmental trauma, stress and neuroscience. You are also the director of PESI UK that you founded under the name Psychotherapy Excellence. And that's how and why we met. Thanks to Deirdre Fay. I really want to thank her here.
Absolutely.
Yeah, she's an angel. And PESI UK is a non-profit organization that is now one of the largest training portal for continuing education in the UK. And we decided to partner together, Quantum Way and PESI UK, a few months ago to bring some of the incredible trainings and conferences that you organize and that you have in your catalog with some of the most renowned speakers and trainers in psychotherapy, in the psychotherapy field, and to bring that to the French speakers. And I know it's really the Quantum Way mission to do that. So thank you very, very much. I know you have a very busy schedule with the conference that is starting next week. Thank you for being with us today.
It's really, my absolute pleasure to be with you today, and also to be sharing some of the great things we are doing with you Quantum Way and those in Europe. It's really a delight. So thank you.
Do you want to talk a little more about what brought you to create Psychotherapy Excellence, which is now PESI and PESI UK? I think it's interesting.
Yeah, well, absolutely. So I started my psychotherapy journey back in 2005, 2006. I had a mini breakdown. So, I have a number of ACEs myself, adverse childhood experiences. And I went into psychotherapy, then did my training. And in around 2011, I was very fortunate enough to sit on a number of boards. So I was a really young psychotherapist with all these great people, kind of a fly on the wall, listening into quite instrumental conversations. And one of the things I realized, certainly in the UK, is that there was so much infighting between the different modalities, the body psychotherapists, slating off the transpersonal psychotherapists and the transpersonal psychotherapists slating off the psychoanalytic therapists. And I thought to myself, this is the very, very core issue of splitting that we are trying to heal, the kind of the either or, the black, white, the you, me, the them, us. And in my world, I, previous to that, was in that world. And so one of the things that I tried to create, Florence, was a platform that would bring together everyone. A platform that was both and. It was me and you. It was them and us. It was all the modalities together on one single platform. At the time, there was also sort of nothing in the market, so nothing that kind of brought all the great people together, certainly in the UK and Europe, and nothing that brought, in terms of how my mind works, that kind of real multiplicity of self. So thanks to my previous many years in marketing, I was able to conceptualize, get developers on a website and launch the business, which I launched in 2012. And if we fast forward several years, I launched as a not-for-profit, sold the business, and I'm still the director nearly 10 years on. So that's really the story, just starting with my own issues, getting through some of them, and really feeling that passion to really heal some of the internal conflicts that are in our profession as a therapist, and wanting to bring people and communities together. And so far, so good. We are the biggest portal in the UK, and I think Europe in terms of what we provide. And now PESI US is the biggest clinical content provider in the world. So as an organization, our needs are about education and helping people out there really understand therapy or different modalities, and really providing that CPD or continuing education to many, many people around the globe.
Yeah, I'm surprised to know that we have kind of the same journey, because I was a marketer before being a therapist. and I'm one of the, I didn't create Quantum Way, but I really joined Quantum Way 2 years ago. And it's really a great, great journey adventure. And I'm glad we are matching so well together.
Yeah. And as they say, great minds think alike. And, just these last couple of months, getting to know you and Liz and Mark and Laura and your team, it really feels like it's a meeting of minds wanting to do really value-driven conferences or ideas that matter. This is about making a difference, and it seems that we are very much on that same trajectory.
Yeah. And so you are the one who created or put together this incredible conference that we're having next week on the 18th and 19th, and that we are part of as French speaker providers or interpreters, or I don't know how we can say it.
Partners.
So my first real question would be, why set up this conference, and why is it so crucial, so important to talk about women's trauma and mental health? What's the point? Why not just a global trauma and mental health conference? Why women?
Yeah. So I think, a couple of things that got me thinking about women in particular. Last year, we saw, obviously, the pandemic hit us. Friends of mine, women that I know, were not, just looking after the kids, doing the cleaning, doing the house, working a full-time job, trying to raise a family in amongst the pandemic. So I was seeing equality and hearing about equality from that perspective when the world went into almost global meltdown. At the same time, there had been some murders in the US, some women handled very, very badly by US police. That was sent viral around the world. And at the same time, I'm doing an applied neuroscience master's at King's College, which started this time last year. And some of the statistics that I've been learning about, certainly about the brain, about trauma, about developmental trauma, what we're seeing is higher rates of PTSD, of affective disorders, of DSM or ICD-10 disorders in women compared to men. And that statistic, based on what I was hearing in COVID, some of the murders that had occurred in the US, together with sort of more of my academic research, I just thought, what we need, I'm done hearing this. I see clients almost every day in my clinic, and yet the statistics I'm seeing on a global scale far outweigh the statistics on men. Now, there might be a number of reasons for that. There's been taboo about sort of men sharing feelings, and we're still evolving in that area, men becoming more embodied and it's okay and safe to share their emotional selves. So there's that. There's obviously less statistics reported with men than women because of that. But I think, when you're starting to see really high evidence-based figures on trauma disorders, and then we look to things like sexual abuse, domestic violence, which escalated dramatically in COVID, I just thought, right, now's the time. I'm going to launch a concept And so it was so successful this year that we launched it globally this year, really to talk about, all things related to women, from culture, racism, misogyny, abuse, any of the ACEs, not disrespecting men, but just to really bring a global gathering of women together with the very, very best clinicians in the world to talk about, well, as therapists, or if you're just joining as a lay person, what are we really dealing with here? How can we help heal this global mission of trauma, and perhaps in time reduce some of these statistics that are often reported in many academic papers?
Yeah, and one figure that Janina Fisher shared with us is that 75% of borderline diagnosed people are women.
Yeah.
And she will be talking about that because it's really important, because she really relates that to trauma, and it's her mission today to change the way we're seeing borderline, where many people are misdiagnosed, many women are misdiagnosed, and it's often a trauma behind this DSM diagnosed.
Absolutely. And, not only that, Florence, not only borderline, but many of the disorders, if you look to the environmental impacts, if we just we can't really put biology aside, but we can sort of look to, how trauma, and we'll hear a lot more from these experts, how trauma really, impacts us. So what does that look like day to day? It looks up your friend calling to say, I'm having an anxiety attack. It looks, another friend saying, I didn't sleep last night, I had a flashback, or I can't sleep. So when we think about, some of these statistics, and that, 75% Janine is talking about, or the other percentage, 1 in 3 women worldwide experience physical or sexual violence. That is a massive statistics. But not only that, for people then to be, well, there's something wrong with you, you've got a diagnosis. Well, actually, when we look to these professionals, it's not, it might be helpful to know what category in terms of medication, if people want to take medication, but to think about, well, certain behaviors become normal when one is either emotionally, physically, sexually, whatever, abused. And so this conference is also about sort of normalizing, some of the problems or symptoms that just normal women day to day experience. Because not a lot of women know that. They might think, oh, well, the doctor or the psychiatrist gave me a diagnosis of borderline personality, so there must be something wrong. The socialization of that. I mean, it's a very, very, very big question and problem that we have, and particularly around women, because it's normally women that are given that diagnosis.
Yeah, and what about there are also, because I think that's something we have to address more and more, which is racial trauma, that women are maybe more affected by. They're more vulnerable to those kind of traumas, right?
Yes, and there is a growing body of evidence to, and it's interesting, this question. There's a growing body of evidence to look at the impact of racial trauma, men and women. Why is there a growing body of evidence to look at racial trauma in terms of, why haven't we been looking at this 10, 20, 30, 40 years ago? And now, because, many organizations, I know our organization, probably your organization, many organizations around the world have become anti-racist organizations. But the evidence should have started earlier on, or certainly, the research should have started earlier on. And it's only now that, organizations are having to almost tick boxes to ensure that there is enough research, being done. And if we think about it, and I'll talk to women in particular, obviously I'm a white middle-class woman. And it was my idea to think, well, I can't just host a conference next week as a white middle-class woman. So we've invited Dr. Ebony Webb, who is an incredible psychologist. She's a DBT and trauma specialist. She is a woman of color, to almost represent, when I was talking about, how important it is to have both and to have them and us. So from a conference perspective, we are really trying to model the both and in this conference. Because, in terms of my socialization and frame, I know Ebony's going to bring something really, really interesting and help us understand more about women, perhaps from, a woman of color perspective, things that we might not be thinking about. But your question, Florence, around, women and race is absolutely, unfortunately, people of color have been socialized over hundreds of years, which if we look to, I'll just bring in some neuroscience, sort of some epigenetics, some vulnerability factors, they become more vulnerable. I mean, I don't know if you know, and I know we're talking about a women's conference, but, Black men have higher susceptibility to schizophrenia. And you can understand why, with the socialization in terms of sort of racial discrimination, together with adversity, coming into different cultures, especially migrants, you can really understand clinically why young men or men in their 20s might be more susceptible to things like schizophrenia and psychosis. Because that is the only way, if it's not completely genetic. It's not normal for us as mammals to exist under so much trauma and not have behaviors. That's just really our brain showing the amount of stress. So this conference, even though we won't be talking about men, we'll certainly be talking about women, and definitely bringing in that kind of the importance of trying to heal marginalized communities, systemic racism, what it looks like when people of color show up in clinics, how as us as white people can look at our sort of, our whiteness and begin to heal our own internal racial thoughts inside.
Yeah, thank you for bringing that, because and we are, I think there are many psychotherapists are still white people. And I think, as you say, I'm also a white woman, middle class. And it's important that we really, as therapists, work on this, because we all carry those racial, I don't know how you say it, but these ideas, even if they are not conscious, in the unconscious, in the subconscious, there are a lot of things that we're carrying from generations and generations. We've talked about transgenerational trauma in October with you too, and this is really something we have to address.
Yeah, and I love what you just said there. It's not something that we might address. It is an absolute, almost biological imperative if we are going to begin to heal from the last, I don't know how many hundreds years. Because it's that kind of, it's that very divide. That's why I set up the company back in 2012. When I mentioned that splitting, that divide, that's exactly it. That's the same thing that happens with race. It's the same thing that happens in ourselves. It's the same human condition, is that where we split or we fragment and the other becomes the other. So I absolutely agree with you that, I'm excited to, especially in a women's conference, to really be bringing sort of how we address systemic racism, marginalized communities, and what we can begin to do even more of to kind of find that, that group voice, that female voice, which is a very, very powerful voice in most countries, but not in all, where women are still silenced.
Yeah, and that's something that I think that we all as human beings should be aware of more and more, that many women can't talk about their traumas, can't talk about their condition, and they don't even dare, and maybe sometimes they don't even know they have those traumas inside, and for them that's normal. And
yeah, and I think, this conversation really opens up almost a can of worms, because in some ways we never ever want to disrespect certain cultures. But in other ways where women's rights are affected, or women are silenced and they're not even conscious of it, they don't know the liberation or the freedom, it does make one question culture. So how can we be with that multiplicity, that complex sort of matrix of what culture and socialization and women and men is, to kind of help bring voice, movement, the unfreezing of where women have been so socialized into their sort of roles in society.
Yeah. I was thinking about, because I heard you talk with Ebony, and I'm really, really happy that we will have the opportunity to have you both, because we cannot translate all the talks, all the sessions of this conference, because there are simultaneous conferences. So we had to choose one set of talks, and there will be one with you and Ebony. And I heard you talk with her about what you do in your clinician work, how you help women get a voice, talk about their trauma, take them out of this silence that they are put into many times. And I think that's interesting to hear you in that.
Mm. And I think, I think voice is one option of finding a voice, but I also think that no voice is a voice. So, for example, what I mean by that is that, when you're working with women, and as you were saying before, I work with a lot of trauma and developmental trauma. So if I've got someone coming in that is unable to speak, which is often the case, especially in horrific incidents, it's very common that there's no verbal language. Just the notion of contacting, it's really hard for you. I can see it's really hard for you to find any words, or, it seems safer for you to, not say anything and keep quiet. Just contacting those parts in people is a stepping stone to finding, I don't know what full voice is, but sort of more movement in terms of a woman's life force in their system. So whether there is voice, as in the speaking voice, and they're able to talk, or whether there is no voice, it is a communication. And I think us as therapists, when we're working, certainly from my perspective, is to make those subtle contacts that it's okay, whatever is showing up in clinic. And it's with the therapist to be able to kind of really contact and make relationship in the right, I would almost say, energetic capacity, without it being too much or too little, so that women can then learn to make that relationship with herself to that part of her.
Yeah, and I was thinking of something. I'm sorry. I think I got caught in a part of me that is saying, what is the most important thing that we have to say and to bring to the audience, that to the people who are listening to us? And I know there are a lot of women, but there are also a lot of men, and that's important. That because it's not a conference, and it's not addressing women's trauma and mental health is not only for women; it's for everybody. And by saying that, I'm getting back to it. I think that what you were saying as therapists, trying to really, when you say no voice is a voice, I would say it's not only as a therapist, it's as somebody who wants to care and to be with somebody else, and like a child or a partner or a friend. And sometimes when you see people that are really in sadness or anger or whatever emotion is there, the first thing to do is not, what are you doing? What do you need? What's happening? Why are you like that? It's really just be with it. And that's something I know you and I as therapists have learned, but not all therapists have learned that, but really that to be with this, so that the nervous system can really attune and can really find a way of being in security and being safe. And I think that we can really, all that we learn and all what we learn in conference and in talks like that, is not only a therapist role, it's really as a human being in relationship with others. And I think that's what we really want to bring to the world. Is it's not only a question of therapists, it's a question of everybody. And what we learn in our office, in our practice, is really can really be spread to all people that are in relationship with people.
Mm. And I'm so glad you mentioned that, because in some ways, I don't know about you, but I feel so lucky to be alive in 2021, where what we have seen, yes, thanks to the internet and thanks to people doing, their great work, is really a proliferation of education in terms of mental health to just the normal person walking down the street, man or woman or child. And our whole society is shifting, or I could probably say has shifted. If you look to Spotify or you look to Amazon, the amount of self-help books and podcasts, and whether it's, Prince Harry or the royals or some other famous figure talking about something, or perhaps the shock of someone like Robin Williams ending his life. We are all connected and impacted, whether it's, bringing more light to mental health and trauma, or having to witness something that you just didn't think was possible from a role model. And so in some ways, we're in a very, very fortunate time in, 2021, because this 30 years ago, people would be like, what are you doing? And right now, this sort of normalization to just say, I'm not feeling great today, or when you said that really hurt me, or no, don't do that, is becoming more the norm, not just in the therapist's office, but on the street or in the household. And I think, part of this women's conference, as you rightly said, is about bringing some of the things we know innately from being therapists to the person that can utilize some of these tools, some of these ways of being in their relationships, but more importantly, their relationships with themselves. I can say yes and I can say no. And that has not often been the main thing in our society, women being able to say yes, but more importantly, no, don't do that. Don't speak to me like that. no, I'm not like that, or I'm only doing this, or you can't treat me like that, stop. So, it just is a very, very powerful moment in this point in time.
And there's a question, and I want to take it of Aurore in the Q&A. And if you have questions, please put them in the Q&A, and we'll try to answer as many questions as we can. First, on the topic of trauma, mental health, and for women, and then we will be answering specific questions around the conference itself, the program and the certificates and etc. But we're trying to really address first this important topic. And Aurore is saying, how do we do when it consumes us to the point of only being in survival mode? And do you have anything to say about that? Or to say to Aurore?
Yeah, so I think that's sort of a really, really good question, because it seems like Aurore, if they're speaking about themselves or someone else, that just noticing that they're in survival mode, that has been the thing, being in survival mode, that has got them through whatever happened, is a really major thing to notice. And the reason why I use the word notice is not just about kind of noticing, oh yeah, I've been in survival mode, but what this person can. I don't know that name in French, so I'm not sure if that's a man or a woman.
It's a woman.
A woman. Oh, thank you. Just noticing that Aurore, you might kind of look to think, well, if I've just been in survival mode, and I know I always haven't lived in survival mode, maybe I can kind of start to unblend. I can notice at times when I'm in survival mode. Is it every waking hour? And maybe it is. But just having that kind of awareness around state can make you unblend from what is not survival mode, or remember a time maybe when you weren't in survival mode. So what we then start to look at is kind of, well, the nervous system is in survival mode, or the part of the person is in survival mode, and to then begin to get a little bit of distance around, oh, I notice when I'm, out with my daughter or my son, or, I don't know, friends or partner, or picking flowers or whatever. Oh, I'm not in survival mode. And even if it's just for a second, and then it's noticing for 5 seconds, and it's noticing different kind of, oh, when am I more in survival mode? Oh, I'm more in survival mode when I'm doing, I don't know, X, whatever the trigger or the activation is. So just noticing that is a real blessing, because it just means that, you can begin to notice a lot more about your state, the nuances of your state, the times when you're not in that state, the times when you're more in that state. And that's why I was talking about that relationship with self. Yes, we're interested in the relationship between us as women to men, or us in relationship to others. But what we're really talking about is that relationship where we begin to notice, well, how am I in relation to kind of parts of myself, or states of myself, or whatever the terminology is that one wants to use.
Yeah, and I would like to add that it's important, as you said, to notice that it's a survival mode, and the survival mode is a survival mode, which means that it helps us to be alive. And it's kind of a sign of resilience. It's the beginning of it, and really bring some compassion for all those parts of us that are trying to do their best to make us live and function and do what we have to do. And even if it's difficult, they are trying their best, and really bring this recognition and bring some gratitude and some compassion inside. I know it's difficult, but if we can just be more compassionate with ourselves, it's also really the beginning of something, a beginning of healing, because we have this power of healing inside. IFS would say the self is healing. In polyvagal theory would say the ventral vagal is healing. In EMDR, we are trying to change the way the brain is doing and functioning. And there are many, and we have the power of healing ourselves.
Mm. Mm. Yeah, I couldn't agree more, Florence. I couldn't agree with more than what you just said. Absolutely.
Yeah. And well, you're very welcome. It's really a pleasure to try to help and to give some
little tidbits,
some trailheads, some things to to follow. There's Shadia who is asking. Wait, I'm gonna try because it's a long question. She has a client who cannot have children, and she has not mourned either a pregnancy or a child. So she has developed since then a significant phobia of insects. She refers to God's will, however, is very angry with herself. How can we help her? That's tricky. That's difficult because I think I would say she really needs to get help from a professional. If it's really it's been lasting for a long time, and we can't get out of mourning, and it becomes difficult to do it by ourselves. And even if we are, I don't know. What do you think about that?
Yeah, well, it sounds like, like if we just go back to what we were talking about at the beginning, when we were talking around, just the communication, it sounds like this person has had a really hard time. Like, we're not born with just behavioral cognitions or emotional outbursts or whatever the symptom is. We don't come into the world like that unless there's a genetic defect. So, the first thing, it just sounds like, my heart goes out to this person because, something's happened. We don't need to know what's happened, but something's happened. And I agree with you, is to sort of meet that in a way that is compassionate, like we were talking about, rather than bring in a judgment or bring in a judgment about oddity or just to really be with, wow, this person has had a really hard time. And I agree with you, Florence, to seek sort of professional advice that can kind of work with those different scenarios and where some of her experiences, some of that past might be continuing to show up in the present, and how sort of behavior then sort of stems from that dysregulation in her body or in her system, would be a really good way forward for some professional advice. And I don't generally like to comment professionally on a webinar. If that is a therapist asking, supervision is a great thing. Check that in with your supervisor, and if it's not a clinician, to, as you say, just really contact that difficult time this person has had, but maybe, see if they can get some professional help.
Yeah. I have a question of Angelique, who is saying, it seems that to me that women are more often ashamed to talk about their trauma because they still seem to be confronted with silences from society. They are silenced by the society. But there are also blocks on the women's sides. It's not only the society, it's also what we carry inside. Do you have anything to add to that? It's really true.
Mm. Yeah, and that's where it begins to get really interesting in terms of, for women to begin to get curious around their mothers, their fathers, their ancestry. Because some of those socializations about the, just say, normal woman's block, if a woman is having a block in a specific area of her life, it's likely, not 100%, that some of those sort of more innate beliefs have come down the line. So, whether it was spoken or not spoken in the mother, the father, the grandmother, the grandfather, their parents, etc., etc. Then when that's compounded by depending on what country you're in, by absolutely the socialization, the misogyny, the patriarchy, the system that we live in, it's very male focused. So when you put those two things together, if you're working clinically, or maybe not, you want to be thinking about that. Those developmental pieces running through the line, and then also about that kind of socialization that happens in our societies. And yes, there are ways through that. Usually that's done through, working with therapists or reading more about some of, the speakers we've got coming up, and loads of others to really help with some of those processes. And I think I just lost you, Florence.
I'm still there.
In terms of...
I'm still...
I think your audio is off.
Yeah, sorry. My audio is there.
There we go.
So I'm back.
So that's what I would sort of say to that is, it becomes complex. And that's why this sort of whole notion of intergenerational, transgenerational trauma becomes important, because those socializations that are in families are strong. They're strong. A lot of families, a lot of females carry that cross on the back. I know I have in the past. And that's why I was saying it requires work with, specialists to really look at some of those deep-rooted beliefs, particularly in females, about the self and what's possible, what's allowed, finding voice.
Yeah, thank you. There's one question that is very general, and we've answered a little at the very beginning, and I think it's interesting to address that. Are there some specificities of trauma manifestations in women, and are there specific therapeutic support that we can bring them?
I think I'm not sure if I totally understood. I'll try. Just let me know if this. So, is the person asking? Is there specific sort of things that?
Is there any specific symptoms that we find in women that we don't find in men? And is there a specific way of, or are there specific ways of therapeutic or healing treatments? Do you think it's different?
Right. So, as Janina Fisher likes to talk about, when you look at things like sleepless nights, low mood, affect dysregulation, disordered eating, the list can go on. These are symptoms that are basically the body's way of showing if there has been trauma or adversity. And so what we say is that's really that sort of implicit memory gives rise to some of the sleepless nights, the disordered eating, the lack of energy, there's so many symptoms. Those symptoms are also prevalent in men. There are many, many men that have many of the same symptoms that come from, traumas are pretty much a dysregulated nervous system if it's not processed. So in answer to the latter part of the question, yes, there are absolutely lots of ways that trauma therapists or trauma-informed therapists can help work with various symptoms depending on what they are, because those are really kind of just symptoms of the deeper dysregulation. And for those of you, maybe you're therapists or not, what I mean by that is that, sometimes, not all the time, but sometimes when trauma happens, it can be stored as a memory in the body. Not in all people. Some people, a lot of us experience trauma and we don't have any symptoms, right? It just processes normally in our nervous system. But when trauma happens in some people, it can kind of be almost like frozen in the here and now back then. And what we then see happening is it happens, then gets replicated in the here and now and gives rise to all sorts of symptoms that come out. And there are many, many, many therapies, whether it's internal family systems, whether it's sensory motor psychotherapy, whether it's, EMDR, even for some people, some cognitive therapies work like TCBT, ECBT, ACT. It doesn't really matter. I think what's really important for sort of healing trauma and adversity is that relationship with the therapist and the therapist's relationship with themselves to ensure that they've done enough work on themselves. Like, when you, Florence, I don't know how it is in your practice, but, for my training, I think one of the biggest influences on my training is to do extreme depth work in myself. I am not able to sit with another in their deepest, darkest pain if I can't sit with some of mine. And I can't sit with all of mine, right? I'd say, I'm a therapist, I'm still in therapy, and I might be in therapy forever, and that's okay. But I know that I can sit with some very, very dark things and not in my body be dysregulated by it. And so I guess what I'm saying there is that, when people are looking to have therapy or trauma therapy or heal something, choose your therapist wisely. Because sometimes I can just sit in silence, or maybe you can sit in silence and not have to do. I'm not fixing something. I'm not doing the latest strategy. What I'm talking about is what we're talking about earlier on, is that I can sit and contact that pain. Someone can physically feel that I'm present. I'm not going off into my own thoughts. I'm not dysregulated. I'm right there, and their system can feel that safe presence. And that's really how systems start to heal. So there's something there in that kind of, as we go back to that relationship with the self, and then relationship with the other is important.
Yeah, and I totally agree that it's so important as therapists to do our job of healing and of going into those deep wounds and deep traumas that we've had and we've gone through. It's so important. That really makes us able to be where the people are, because we've been there too.
Yeah.
I really totally agree. It's so important.
And this notion to, I don't know, maybe in your practice, but sometimes in my practice, or sometimes when you want something like this and people think, oh, they must be like totally enlightened, or they must have no problems. No, I have lots of problems. We all do. It's being human, but my relationship is different to some things. And, it's really about kind of, again, breaking that sort of belief that, therapists have it all worked out, because you know what? Well, in my experience, we don't. And I know a lot of really good therapists, some of them the best in the world. So, yeah.
And I think it's the same for parents. Like when parents bring a child, I don't know if you work with children, but I do. And when parents bring the child and you see that there's a problem, but it's important to bring the whole family and to heal the family before trying to heal whatever happens to the child. It's really important that everybody can do their work. And that really helps everybody.
Yeah, couldn't agree more, Florence.
Yeah. I'd like to go a little bit through the program of the conference, because it's It's a huge one. I know that for some people it's kind of difficult because it's a paying conference. You have to pay to get in. We wish we could do it for free, but it's not possible. It's a lot of work, and we have wonderful, really speakers. But I know it's so important that people can really get a glance of what they will be getting if they register today or tomorrow or within the week. And Mehdi will put the link again in the chat. There are many people that we don't know in France, and I know they're really great. But we know, more or less, we know Janina Fisher, most of at least in the therapy field, we know Janina Fisher, and she was in our trauma conference in last April, and Pat Ogden, that she was in, because she's well known in the somatic experience and somatic field. But there are many people we don't know. So is there any thing you want to say about one or the other that we must, this is like the must see, or?
Yeah. Well, I mean, there's so many that come to mind that I just want to rave about because, well, let's just start off. I don't have the full agenda on this computer, but I'll just sort of start off with what's on my mind. So, we're starting off with a really deep conversation with myself, my co-host, Dr. Ebony Webb, and a woman by the name of Susie Orbach. And Susie Orbach is an esteemed and acclaimed psychoanalyst in the UK. She's a writer for The Guardian. She's brought out a number of books. She brought out Fat as a Feminist Issue, Bodies. These are all sort of, women's issues way back in the 70s and the 80s. What's more is that her and one of her colleagues and friends started a women's center in both London and New York in the, I think, late 70s, early 80s. I think I've got those dates right. Now, I mean, how forward-thinking is that? We've got one of the pioneers in terms of the women's movement on that we're going to be interviewing first out. And she's a very, very experienced psychoanalyst. And I just feel really delighted. If you don't know about Susie, if you don't know her work, Google her on Amazon, get her books. She was writing about women's issues from the get-go. So it's a real privilege to have her as a part of this conference. Oh, she's also been instrumental in starting things like with some other founders, but certainly in the UK, the Relational School. So you can Google that. And the Relational School was about bringing relationality to psychoanalysis, where psychoanalysis was pretty much your Freud, patients on the couch, you're sitting back, looking in terms of free association, where her and a number of other UK therapists brought in that relational element. What does that then look like in the psychoanalytic model? So that's going to be really, really interesting. I think there's so many others. We've got Efu, and I always know as Efu, and I've actually forgotten her surname. Maybe you can spell it.
It's Afranasia Niaki.
There we go.
Right?
There we go. And, Efu is an incredible somatic experiencing clinician, born in Africa, moved to Brazil. She really brings in trauma, beliefs. She's very intuitive. And I think just really embodies I want to say like an African spirit. Like I'm from Africa. So I'm originally from Africa. So when I look to Efu, I just see this incredible healer. So you're going to learn like a lot of things in Efu's presentation that maybe you wouldn't learn in others, because her approach is very embodied. It's very almost ancestral in ways, things that we can't really put evidence or academic work to, but it certainly will come through in a presentation. We've then got people like...
and I just want to add something, because as I said at the beginning, and I don't know if everyone was there, we can't translate all talks live. So this one from EFRU will be translated, but after that, within a week, I think, next to after the conference. But people who want to listen to her in English, they will have the opportunity to listen to her in English live, and it will be translated a week after. So we had to make a choice, and so we, at the same hour, at the same time, we have Kathy Steele, and Kathy Steele is talking about shame in sexual abuse in women, and we really thought it was so important topic. So that's the way we managed to bring this conference for French speakers. Yeah, it's important that we say that. And talking about technical things, everything will be on our portal in Quantum Way Thinkific, so everybody will get login and password to go directly to the online conference. And yes, people will get certificates when attending, so both PESI and Quantum Way certificates. So don't worry about that.
And Kathy, I mean, what we have here is a conference with such great names, and I just get super excited because, Kathy Steele, let's look at Kathy Steele. She has produced a number of books on structural dissociation with Suzette Boone and forgotten his first name, Niehaus. I think that's how you pronounce it, sort of a Dutch academic. And really looking at that model of structural dissociation. So when sexual abuse happens, the main thing that happens is that there is a fragmentation, or certainly there can be a fragmentation if a woman's system is predisposed. So, Kathy Steele's work will really look at that model and normalize, actually, when such a horrific event happens to a woman and to men, it's not just to women, what is a sort of a model that, so someone can conceptualize the parts of themselves and learn to understand, the part that freezes, the part that wants to flee, the part that just collapses, that very kind of parasympathetic normal response that happens when we have trauma. So I'm very, very excited about her presentation, and then the role of shame in that. I think it's going to give people, a really nice model to understand themselves or their patients or clients that they work with.
Yeah, thank you. And yes, people are asking, can they choose which one they want to listen to live? They can choose. Not for the French. For the French, there will be only one channel. But if they speak English, they can go from one to another with a really an easy way. But they will get the replay of all talks translated into French after the conference. Yeah. So that's important to say. And as it is an international and it's globally, we're starting quite late in the afternoon. It will be 3 p.m. our time. It's 2 p.m. your time. But it allows the U.S. to be part of the all U.S. To be part of the conference. So that's why it's between 3 p.m. and 11 p.m. our time. So people know it's not usual. Usually it's during the day and even in the evening, but not so late. So, okay. Are there any? I know we can't go through all the program, but all the program is on the website, and the website is both in French and English on Quantum Way. And you can register in French and English on both sides. So that's really, and I hope you will be many to register. And you have the early bird price, I think, until Friday. So do it quick. It's kind of it's an interesting price, really. It's because it's 17 talks, 17 people, 17 really experts talking about those. And I think the field of trauma is so huge. There are so many things to say that we can do. We've done 35 talks in April, and this isn't enough to cover all the topics.
Yeah, exactly. And I think, Florence, just to sort of add to that, when people sign up, they get access to Janina Fisher's Transforming the Living Legacy workshop. So they get automatic access. That's a 6-hour workshop. They also get access to, some really cool bonus sessions. One of the bonus sessions is Dr. Rachel Yehuda talking about sort of epigenetics and the Holocaust and trauma and how what happened 100 years back really affects our biology, our epigenome, and in some cases our genome. And that's really, really important. It's quite biological. You might get lost in some of it might go over your head. I think there are some important takeaways from her. They've proven that psychotherapy actually has an impact on the epigenome. So that means that, what we're doing or what we are doing more of actually can reverse the effects of trauma in psychotherapy. And that's just amazing. And then the second thing, and it's a pity Dr. Judith Herman couldn't be live with us. I know she's writing a book and she sends apologies, but she's right in the thick of things. Anyway, we've got her talk from last year. If those of you who don't know Dr. Judith Herman, she is the mother, the grandmother. We give thanks to really her work on beginning to realize the pervasiveness of trauma with regard to women, sexual abuse, emotional abuse, domestic violence, all that kind of thing. Way back in, was it the 70s and the 80s? I know Janina Fisher was one of her students. So now we've got, both Janina Fisher, who's really great right now, but we've also got Judith Herman talking about sort of justice and a woman's place in society in terms of justice. So, that's just some of the bonuses we've got there too.
Yeah. And for the French speaker, they won't have the whole 6 hours of Janina Fisher because it was too complicated to translate it. So really, it's a huge work, and we'll do it later on as an online course, I think. But there's also a talk of Janina Fisher that she gave at our April summit, and it's free. It's a bonus too. And Judith Herman will be translated, not now, but in a week or two. So they will get that too.
Great.
Yeah. And I know people are asking if they can choose and pay just for the talks that they're choosing, but it's not possible, unfortunately. It's really the whole package that people have to get. But it's when you get it, you can decide to register for a unlimited replay. It's a little extra. It's 50 euros more, but you will get an unlimited replay, and then you can really access to all the conferences and all the talks when you want, how many times you want, whenever you want, where you want. So that's a great that's a great opportunity for everyone. Okay. Is there anything you want to add before we end? Because I know it's already 7:15, and it was we were supposed to be an hour. So that's what we did. Sorry for the. I'm really glad we had this conversation and that we can talk about this conference. And even if people can't attend this conference, they get I hope they got some things to carry home and to begin to work with. And we are going to continue anyway to talk about trauma, to have some webinars and free online summits. So it's not the only one that is talking about trauma, but this one is very special. And it's special also because we're doing it with you, with PESI, and with you, Tracy. I'm really, really happy of this partnership.
Likewise, and I just echo, Florence, what you've said. First of all, thank you to inviting me to, just be a part of your talks. It's been a real pleasure and privilege to be on here. But just to echo some of your words around, if you can join us, fantastic. If you can't join us, I hope you've got some little pieces of information that you can take away. I think there are many, many ways and possibilities about how we begin to heal society, certainly about women's place in society and about changing those, almost outdated socializations that women have been socialized into. So, even if you're just taking that and that awareness, that's absolutely really the start of something great.
And everything will be translated into French. There's somebody who's saying we have to choose. No, everything will be translated. Every single session will be translated into French, not during the live, but afterwards. So everything will be translated. That's really important. Okay, so thank you to everybody. Thank you. A very, very special thank to you, Tracy. Thank you, Anne-Laure, because we don't hear her together.
Thank you, Anne-Laure.
But she's there Amazing. Behind. Thank you. She's doing an amazing job, I know. And she's going to be translating from 3 to 11 p.m. next week. So a big thank you in advance to her for all those who will be with us. And hope to see you. Well, we'll see you soon.
Yeah.
During the conference. Great. And I know we're this is not the first time you're on the Quantum Way Rencontre, because we really, I think we really have a lot of to share together with you.
Yeah, and likewise, from my perspective, Florence, likewise with us to you. I'm really excited about our partnership moving forward, and if there's anything, we can do to be closer to France and Europe, despite this politics, we will do everything that we can to come together as a community of therapists and people who are interested in what we're doing. It's really important.
It is. And it's not only for therapists, it's really for everybody. That's really an opportunity to access those wonderful speakers, even if we're not therapists. So thank you for joining us. Have a nice evening for the Europeans. Have a nice afternoon for the East Coast and the Quebec. And see you soon.
Great. Bye, everyone. Thanks, Florence.
Bye-bye. Thank you.
Bye for now. Bye-bye.